Hi guys, this is Letta. Letta simply means let's talk about addiction, and I'm your host Amara. In today's video, we'll continue with the reasons why people abuse drugs, alcohol, and other substances and eventually become addicted to them. You remember that in the previous video, I called these reasons triggers, and in the previous video, we also talked about the voluntary triggers. But in today's video, we'll be talking about involuntary triggers. Most people abuse drugs, alcohol and other substances because of certain situations that are beyond their control that can oftentimes mess with their mental health. For instance, we have a wounded soldier or policeman or other paramilitary personnel. Most military officers involuntarily use these addictive substances to subdue their nightmares or to cope with horrific experiences that they encountered or they witnessed during combat or during war. Then secondly, we have accident victims, be it road traffic accidents, plane crash survivors, or even domestic accidents. Oftentimes, some of these accident victims, they end up abusing pain medication that their doctors prescribe for them, and they eventually become addicted to these drugs. Then nextly, we have PTSD, post-traumatic stress disorders. We will discuss PTSD in details in a later video, but I want to mention the traumatic experiences that one could encounter that can make one to abuse drug or alcohol or substances. And the traumatic experiences, they include rape, we have armed robbery attacks, we have child abuse, domestic violence, accident, war, molestation, and the rest of them. Then next, we have sickle cell crisis. Most sicklers sometimes they abuse the pain medication that their doctors normally use to take care of them during the sickle cell crisis. Then from abusing this medication, they eventually also become addicted to them. Then we have post-operative patients. At times after surgeries, especially major surgeries, post-operative patients are usually placed on analgesics, and sometimes they end up abusing these opioids or narcotics that were normally used for them post-operatively, and they also eventually become addicted to them. Then lastly, we have cancer patients. Obviously, cancer patients they always experience pain, and their doctors place them on pain medications to manage the cancer. And sometimes, even when they are in remission, they continue to abuse these medications and they eventually become addicted to them. This is where we will be ending in today's video. Continue to drop your comments, and I look forward to hearing from you. Like and share with your friends. And once more, this is Letta. Letta simply means let's talk about addiction. And I'm your host, Amara.